This is Dr. Jagadeesh, Senior Consultant Physician, KIMS Hospitals. Today we are going to discuss about diabetes. Diabetes, probably there is a huge information available in your WhatsApp, in your YouTube or in Google. But in spite of all the exclusive awareness and campaigns going on diabetes, still India is a diabetes capital and we see a lot of diabetes patients in our regular practice. I decided to talk about diabetes today because for the upcoming World's Diabetes Day on November 14th. So why is that? What is important? What is that we are looking for diabetes? What are we trying to make people understand about diabetes? Yes. So I'll put it in very simpler words. So usually people think diabetes have to have some symptoms to approach to the doctor. No, not necessarily. So the symptoms, whatever we talk about diabetes, like polyuria, polydipsia, in the sense taking water multiple times, going for urine for multiple times, particularly nocturnal urination, going urine in the night for multiple times, and the other commonest thing what people assume is poor healing of the wounds. These are the commonest complaints or the symptoms what people expect when they have diabetes. Of course, this is partially true. But when is this true? When your blood sugars are usually more than 250 or 300 or 350, this kind of symptoms do exist or possible. But we are trying to treat you at very early stage, in the sense diabetes per se, by definition, when someone's fasting blood sugar is more than 126 with the 8 hours of fasting, or postprandial, in the sense checking a blood sugar after 2 hours of your eating time, if the blood sugar is more than 200 postprandial, or your 3 months average HbA1c value is more than 6.5, then we consider as diabetes. So to understand the definition per se, as per the numbers are fasting 126, postprandial 200 or more, HbA1c 6.5 or more, is called as or defined as diabetes. Now coming to diabetes, how many people do have diabetes? Will it be reversible? Is it irreversible? Yes, everyone have this question. A lot of people do ask me, doctor, I want to get treated naturally. I don't want medications. I don't want insulin. So I want it to be reversible. Yes, of course, every doctor who treats you wants you not to be on tablets. Of course, is it possible? That is what we have to understand. See, diabetes is because of multiple reasons. It is multifactorial. One among that, as most of you know, genetic. The second one is what you eat. The other thing is how active are you physically? Are you running? Are you jogging? Are you walking every day? Are you moving from the place you are working? The other important thing is your stress. The stress can be lack of sleep, the stress can be infections, the stress can be adding multiple medications for some other reasons. So why am I insisting on stress? Because stress induced high sugars, stress induced hyperglycemia is temporary, is reversible, provided your stress is being taken care. So this is one part. Lot of people think that they tell we reverse your diabetes. Of course, diabetes reversal is partially true, provided your diabetes is on the borderlines, provided your diabetes or high sugars is because of high stress in the recent past, maybe a month or 2 months or 3 months. Diabetes is reversible when it is because of infections, when it is because of intake of any steroid medications for some other things. Now coming back to can we treat diabetes with natural remedies? Of course, yes. But what is the spectrum? If I consider diabetes, first people have to understand any person who has blood sugars, as the definition I was talking about, If your fasting is more than 126, we call you diabetes. So I call people who have fasting sugar 130 as diabetes, 180 fasting is called diabetes, 200 is diabetes, and 400 is diabetes. Now please understand, if your sugars are marginal, if your sugars are borderline, so there are every chance for you to get treated with no medications, only lifestyle modifications like increased physical activity and decreased carbohydrate or high glycemic index foods. You can always control your diabetes, or you can always get back your diabetes to normal status. Yes, possible, but this is not the solution for all the people. We see lot of patients who enter the hospital, who come to our clinics for various other reasons. When we check their blood sugars, it is 300, 350. Their HbA1c is like 10.8, 11.5. So these are the patients, they may not get cured only out of natural remedies or controlling food or doing increased physical activity. Yeah, possible until and unless this entire high sugars is within a very short span of time because of stress hyperglycemia. So what am I trying to tell? Not diabetes is treatment of diabetes is not like one size fits for all. So few people can be managed with only home remedies, few people can be managed with only diet control, few people can be managed with diet control as well as physical activity, and few people have to have on oral diabetic medications, and few most worst people have to be on insulin also. So please do understand, don't compare your diabetes status just because the numbers are same. Your treatment may not be same as your neighbor, as your colleague, as your family member. So diabetes management is multifaceted. It depends upon your lifestyle, it depends upon your sleeping patterns, it depends upon your food what you take, it depends upon are you on a night shift or not, it depends upon what kind of personality are you.